Hello everybody. Does using antimicrobial-coated catheters reduce infection rates compared to standard catheters in hospitalized patients? Catheter-associated urinary tract infections, COTIs, are a significant concern in hospitalized patients, contributing to morbidity, prolonged hospital stays, and increased healthcare costs. A promising innovation, antimicrobial-coated catheters, aims to prevent bacterial colonization and biofilm formation, thereby reducing infection rates. My interest in this topic stems from observing recurrent COTIs in clinical practice, particularly in patients requiring prolonged catheterization. These infections often result in unnecessary antibiotic use, increasing the risk of antimicrobial resistance. Evaluating the effectiveness of antimicrobial-coated catheters is crucial for improving patients' outcomes and optimizing infection control strategies. This topic aligns with my commitment to evidence-based nursing practices and addressing patient safety challenges in acute care settings. Clinical problem. The prevalence of catheter-associated urinary tract infections, COTIs, a leading healthcare-associated infection based on clinical problem. COTIs are associated with the use of indwelling urinary catheters, which can introduce pathogens into the urinary tract. This often results in complications such as urosepsis, acute kidney injury, electrolyte imbalance, extended hospital stays, and increased mortality rates. COTIs also lead to a higher healthcare cost and contribute to the global issue of antibiotic resistance due to frequent use of antibiotics for treatment. Meddings et al. 2019. COTIs also affect patients who need long-term catheterization more than others, like those in intensive care units for who have trouble moving around. This shows the need for better preventive measures such as catheters coated with antimicrobials. My PICOT question. The population in this PICOT question includes hospitalized patients with indwelling urinary catheters who are at risk of developing catheter-associated urinary tract infections. This population is particularly vulnerable due to prolonged catheterization, immobility, and underlying health conditions. COTIs are prevalent healthcare-associated infection, emphasizing the need for effective preventive strategies. Meddings et al. 2019. Intervention. The intervention involves the use of antimicrobial-coated catheters. The design of these catheters aims to thwart bacterial adhesion and biofilm formation, which significantly contribute to COTI. The antimicrobial agents used, such as solutions or antibiotic coatings, aim to reduce the incidence of infections by providing a protective barrier. Clinical settings traditionally use standard non-coated urinary catheters for comparison. Standard catheters lack antimicrobial properties and rely solely on proper insertion and maintenance protocols to reduce infection risks. The desired outcome is a reduction in infection rates among patients using antimicrobial-coated catheters compared to those with standard catheters. Metrics include fewer documented COTIs, reduced use of antibiotics for treatment, and shorter hospital stays, all of which improve patient outcomes and reduce healthcare costs. My search strategy, I use Sinahol, PubMed, and Google Scholar databases. I utilize the Loyola Notre Dame Library Services. By accessing the resources, I selected the Sinahol Plus with full text and Medline databases. Both are very esteemed in nursing and medical research articles. And then I use the phrases antimicrobial-coated urinary catheter, decreased infection, and hospitalized patients, and connected by Boolean operators such as or, and to refine the search. I also selected peer-reviewed full-text article and published between 2017 to 2024. This criteria endorsed that I retrieve contemporary evidence-based studies directly relevant to my PCOT question. This systematic approach streamlined my search and provided high-quality articles addressing the efficacy of antimicrobial-coated catheters in reducing infection rates. Evidences. The studies that were looked at showed that urinary catheters that antimicrobial coatings effectively lower the number of catheter-associated urinary tract infections, COTIs. Ferguson 2018 and McGloin et al. 2024 both talk about how multidisciplinary approaches, which including using antimicrobial technology, have been very successful in lowering infection rates. Porta Segura et al. 2024 demonstrate the effectiveness of muscle-inspired nanocomposite coatings which inhibit bacterial colonization and biofilm formation. Anderson et al. 2020 talk about how polyhexidine-based solutions can be used to keep catheters clean and show that they reduce the growth of bacteria. Burgess-Cross et al. 2019 validate periurethral antimicrobial irrigation systems in preventing extraluminal biofilm formation. These findings confirm the practical significance of antimicrobial coatings in reducing infection risks, decreasing reliance on systemic antibiotics, and improving patient outcomes. Collectively, this evidence supports a clear answer to the PCOT question. Using antimicrobial-coated catheters reduces COTIS rates compared to standard catheters. The improved patient outcome. The information from these studies can significantly improve clinical practice and patient outcomes by promoting the adoption of antimicrobial-coated urinary catheters as a standard for high-risk patients. Incorporating these catheters into hospital protocols can reduce COTI rates, improving patient safety and minimizing the use of systemic antibiotics, which helps combat antibiotic resistance. Porta Segura et al. 2024, McGloin et al. 2024. Additionally, the findings highlight the importance of multidisciplinary approaches, the proper catheter maintenance to optimize outcomes. Ferguson 2018, Anderson et al. 2020. By integrating innovative coatings and periurethral irrigation systems, healthcare providers can prevent biofilm formation and bacterial colonization, addressing a key contributor to COTIS. Burgess-Cross et al. 2019. Implementing these practices enhances patient satisfaction, shortens hospital stays, and reduces healthcare costs, emphasizing the value of evidence-based interventions in infections. And this we can control the infections. Here is my references. Thank you very much.